Good morning, everyone. We are live from the Maryland Healthcare Connection down at the Hyatt Regency, Baltimore Inner Harbor, where we are having an enrollment event today for health insurance through the Maryland Healthcare Connection. So invite all of your friends, invite your followers, and I am going to be speaking with Joseph, and he is one of the healthcare navigators, and he is going to be answering some questions for us today. Hey, Joseph.
How's it going?
Let's get our cameras adjusted here. Okay, so you are one of the navigators at the Maryland Healthcare Connection, right?
Yes, I've been doing this for a couple of years now.
Okay. All right. And so your job is to help get our consumers enrolled in healthcare insurance, correct?
Yes.
Okay. So let's talk about where we are located. Hi, Laura. How are you? Let's talk about where we're located. We are at 300 Light Street, which is the Hyatt Regency, Baltimore, Inner Harbor. And there are a few different ways you can get here via public transportation. So if you take the Metro line down, it's accessible via the Charles Center Metro Station. The light rail, you can get, the closest stop is Convention Center. And then the bus, there's a few different routes that you could take, but the ones that will get you the closest are the number 3 and the number 11. And finally, the Charm City Circulator will also get you here if you take the purple route, the orange, or the blue line. So we are going to be here until 2 p.m. today, and I know the Ravens game starts at 1, but this is really important. So you guys get down here. If you get here, as soon as possible, then you'll be out in time for the Ravens game. So right now, if you could just invite your followers, if you have an iPhone, slide to the right, and then you can invite your followers that way. Or if you have an Android device, you can swipe up and invite your followers to join that way. So Joseph, why is it that we need health insurance?
Having health insurance gives you peace of mind when you need it, when you run into a problem, when you get injured or something. It's nice to know that you have something that can cover some of the cost of your treatments when you need it. So also, not having health insurance means that you're responsible primarily for the bill. So at least having health insurance, you can have the insurance company cover part of your medical treatments, if not all of it.
Exactly, because that's one of the quickest ways that you can actually go bankrupt is by having an unexpected health event and have to go into the hospital, and that can cost you several thousands of dollars. So it's really imperative that everyone have health insurance. So what are the deadlines to sign up during the open enrollment period?
Well, the open enrollment period ends on January 31st. The deadline for January 1st coverage is the 15th of December, so that's coming up very quickly. Now, you can also get state Medicaid through the Maryland Health Connection, and that has no open enrollment period, so you can sign up for Medicaid at any point during the year.
Okay. So why is the Maryland Healthcare Connection hosting this event today?
Because we're just here to help Marylanders get health insurance. We realize the importance of having health insurance for reasons that we've stated earlier. So we just want to have this event here on Sunday so that people can get out. We don't want anyone to have any excuses not to have it. So we come out here on a Sunday for a couple hours helping people. Sometimes they may not be able to come during the week when we're open. So we host these events to help people who will maybe not be able to get to our locations. So.
Okay, so they try to a central location for the city to make it accessible to as many people as possible. So how can people enroll in health insurance through the Maryland Healthcare Connection?
Well, there are a couple ways to do it. Maryland Health Connection has a call center line, 1-855-642-8572, so you can do it over the phone. You can come in person to see a person like myself or one of the many navigators here through HCAM.
Doesn't he look really friendly?
Got me blushing. You can also do it online yourself at marylandhealthconnection.gov, but if you don't feel comfortable using the computer, you can always come in and someone here will help you.
Okay, so what kinds of plans are available?
Well, they do have public plans, Medicaid, the Maryland Children's Health Insurance Program if you're eligible, but they also have plans through private carriers, Kaiser Permanente, Care First, United Healthcare, Cigna. So you can, you have, you have like private carriers that you can, compare their plans. You can shop for coverage. They're well-known brands in the state of Maryland. So.
And actually, you mentioned Kaiser Permanente. There are actually a few of the vendors here today. There's Kaiser Permanente. I see Care First, and also United Healthcare and Evergreen Health is also here. Yeah. So at the end of the broadcast, I'm going to go around to the vendor table so you guys can actually see who's in the room today. So how does Maryland Healthcare Connection make insurance more affordable for Marylanders?
Well, if you're eligible for free, this public insurance, you can't beat free. So Maryland Health Connection provides a way to apply for state Medicaid. But there are also tax credits to help bring down the cost of the premium. And there are also cost sharing reductions, which is like simply a discount on your out-of-pocket expenses. So you can select a plan originally that had a $1,300 deductible, but if your cost sharing reduction is large enough, it could reduce it to zero.
Okay, that's awesome. So who exactly qualifies for the financial help?
Well, you have to be a resident of the state of Maryland. You have to be a U.S. citizen or lawfully present, and your income has to be within certain ranges. So it is kind of based on income and family size.
Okay, and what do you need to do to get signed up for a plan through Maryland Healthcare Connection? If you were already enrolled last year, do you need to renew? Do you need to do anything?
Well, there's an auto renew feature, so if you selected last year to have it auto renewed and you like what you had, then you can the system will do it for you if you gave it the permission to do that. But if you want to come in shop for 2016 plans, because the premiums change, sometimes they go up, sometimes they go down, but if you want to look for another plan, you can come in and see a navigator like one of us, and we'll be able to help you with that. We're all trained and certified and ready to help.
Awesome. So what do they need to bring with them, like in terms of like a driver's license? Do they need to bring any type of income statements or anything like that in order to get signed up today?
You could be doing this with us. You got it right on. You hit the nail right on the head. Just a form of identification so that we can know that you are who you say you are. Proof of income. If you receive Social Security, that would be like a benefit statement. If you receive wages through a job, that would be a month's worth of pay stubs. It's always good to bring more information than not. So if you want to bring birth certificates, a lot of times the system can verify it, but bring your birth certificates. But as long as you have proof of income, tax returns, pay stubs, and identification, you should be fine.
Okay, awesome. So who are the primary targets? Like people that work under 30 hours a week, right? People that might be self-employed, people that are retired and may not be eligible for Medicare just yet. Those are the people that really need to be looking at health insurance options, because if they aren't covered through some sort of health insurance, there's a penalty in 2016 and it's $695, right?
Yes. Or a percentage, or like 2.5% of your income, whichever is higher. So it could be that dollar amount.
Oh, it could be more.
Right, it could be more. So it's very important that if you don't have access to affordable coverage, come see a navigator and let us help you pick a plan.
Okay. Thank you. Oh, hi, Goldie. How are you? Okay, so now we're going to open it up for questions and answers. If anybody has any questions about anything that we covered today, or if you need to know how to get here, if you need the website is marylandhealthconnection.gov. Okay, so marylandhealthconnection.gov is where you can go to shop around and look at all the different plans that are available. And they start off at is it bronze level coverage and goes all the way up to platinum?
Right, yeah, they have 4 different plan levels: bronze, silver, gold, and platinum. These are for the private carriers. It just means that bronze plans, the insurance company will cover 60% of the cost of the healthcare. You'll be responsible for 40%. So those plans usually have very low premiums, but the deductibles are very high. So if you want to use it a lot, bronze may not be the best way to go.
Right.
Then you have silver, which is 70-30, gold 80-20, platinum 90-10. And you'll spend a lot on the premiums on the platinums, but the out-of-pocket expenses will be lower. But the cost sharing reductions that we spoke about earlier, they're only applicable to silver plans. So it can make a silver plan just as attractive as a gold or platinum, and you're not paying gold or platinum prices.
Okay. Well, very awesome. I don't think that I saw any questions come across the screen, but if you guys have any questions, go ahead and type them in now. We're going to be on for a few more minutes, and I'm actually going to show you guys the vendors that are in the room. So we're going to get up and walk around for just a bit. Thank you so much, Joseph.
Thank you.
It was a pleasure talking to you.
Okay.
So premium costs, we do have a question.
Oh, okay.
Premium costs are not the same for everyone.
Right, that is correct. It depends, the size of the credit is going to depend on your household and your income, so it differs from person to person.
Okay, thank you. So this is the Evergreen Health table. So Evergreen Health is in the building today. And he is talking to consumers. And then we have United Healthcare. What about indigent patients with low income? I'm trying to answer questions and also show you guys as well. Okay, so in terms of indigent populations, those people actually may be eligible for Medicaid if they meet the income requirements or if they meet the eligibility requirements for Medicaid. And if they do not, for those who cannot afford the premium, then there would be a waiver. For if the premium is more than 8% of your annual income, then you are not required to carry health insurance, so you would get a waiver for the penalty. In those particular cases, I would really reach out to the state agency and see if you qualify for a Medicaid plan, because if your income is that low, then hopefully Medicaid insurance would be available to you and your family. Hope that helps answer your question. But if you make enough money to where you can afford one of the low premium options, which would be the bronze level plan, those should be available for under $100 a month. You're welcome. So next we have the United Way, and she is here with 211, and I really have a big heart for the United Way. Did you want to say a couple of words about why you're here today?
Sure. Well, so 211 Maryland is a free 24-hour information and referral helpline for like all sorts of different health and human service resources. So we thought this would be a really good place to be, so that if people have questions or concerns kind of beyond their health care needs, hopefully I can help them, give them some different resources. So thanks for having us.
Sure. Thank you for being here. And also, this is United Healthcare. Did you want to share a couple of words about why you're here today?
Sure. So United Healthcare is here today to provide information to any of the participants on United Healthcare Community Plan, but we also have information on our other product which we do offer on the exchange.
Okay, thank you. And this is a representative from Evergreen Health. Did you want to say a couple of words about why you're here today?
We're here to help out people find good plans, something that's affordable for you, as well as meets your financial needs and your budget. Evergreen's got a lot of good copay plans, which means you're not paying a lot of money out of pocket. So if you do need to have something more affordable with a higher deductible, you could still get your medications at $5, sometimes $10, which is a great service.
Okay, thank you.
Thank you.
And this is Steven at the Maryland Healthcare Connection, and he is helping me out today. And we have Care First Blue Cross Blue Shield is also here today. Did you want to share a couple of words about why you're here today at the enrollment event?
Sure. We're here today just to answer any questions that you have in regards to our 12 plans, so feel free to come on over.
Thank you. Hello, and this is the State of Maryland Insurance Administration. Can you tell us a little bit about why you're here at the enrollment event today?
We're the state agency that regulates the insurance industry in Maryland.
Thank you. So they are the ones that are making this event possible and making sure that all the plans are affordable and that everyone gets the word about insurance. So thank you for being here. And this is the Kaiser Permanente table. So I didn't see any more questions come across, so thank you guys for joining us this morning. And if you need to get coverage, come on down. We are at the Hyatt Regency Baltimore until 2 p.m. today, and make sure that you get covered. The deadline for enrollment is January the 31st, but if you would like to get coverage starting January 1st, you need to get registered by December the 15th, which is Tuesday. Thank you. Thanks, Laura. Thank you for tuning in. Have a good day, guys.